Hello, I'm Josh Gordon, Policy Director.
And I'm Diane Lim-Rogers, Chief Economist.
And today we're going to talk a little bit about Concord's latest issue brief about the endgame negotiations for healthcare reform legislation.
So before the winter break, we had both a Senate version and a House version passed in Congress. But they're really quite different, aren't they, Josh?
Yeah, there are some major differences that have to be worked out, and the choices that they make are going to have major implications for the fiscal responsibility of the legislation and what we can look forward to in the future for healthcare cost control.
So what do you think are the really big pieces that make a huge difference in terms of cost control and bending the health cost curve, as they say?
I think the biggest things are the excise tax on high-cost insurance plans that's in the Senate legislation and the Medicare payment commission that's in also the Senate legislation. Do you want to talk a little bit about the excise tax and the differences in the revenue measures between the two bills?
Yeah, sure. So I guess we came out in the issue brief with expressing a preference for the Senate version of the tax offset, and that's because the Senate version is a way of indirectly taxing employer-provided health benefits, which is currently the largest tax preference in the federal budget. We like it at Concord because it's a way of both finding a revenue offset that's able to keep up with rising healthcare costs, and they're still going to rise in the future, even with our best efforts in this health reform. And also, it's a way of making the tax system more efficient. And finally, it's a way of combining the goal of healthcare reform and cost control with tax reform and coming up with a more efficient tax base.
And I guess the problem that we spoke of in the issue brief with the House's offset, this upper income millionaires tax, as they call it sometimes, is that while that is a revenue source, it's not one that keeps up with healthcare spending. And that really is the main difference if you look over the long term about whether the legislation can remain revenue neutral or even deficit reducing over the long term.
Sure, and I think that high-end income tax has the additional problem of relying a little bit on an unindexed specification in order to keep growing a little bit, at least a little bit over time, although it doesn't keep up with health spending, certainly. So, Josh, the other big difference between the House and the Senate bill is in the presence of an advisory board in the Senate bill. Could you address that a little bit?
Yeah, one of the main theories of cost control is that you're going to have some way to shift Medicare from fee-for-service to paying for a higher quality or more value. And one of the ways to do that is to have a Medicare payments commission. They call it actually an independent payment advisory board. This will be a way to switch Medicare to getting more bang for the buck. And you have to do something like that free from political interference to some degree because there are so many providers, either the doctors or the hospitals, that have something to lose or something to gain. And so by taking it out of the hands of members of Congress to some degree, only a minor degree will it really be removed from political tinkering, but that'll be important enough that there will be some momentum behind these cost control measures. And the Senate bill started out in the beginning with a pretty strong commission. Then through the legislative process, it got weakened, and at the very end, it was strengthened again. And so the real key in conference is if that strengthened commission makes it through. The House bill doesn't have a commission. Another thing the commission and the Senate will be able to do is make recommendations on how the private healthcare system could move more towards paying for value over quantity. And so we would look for Medicare to kind of lead the way towards this transformation of paying for care. And I think that's really going to be a key in making the American system more efficient.
What's the administration's position on this idea of a commission?
Well, the administration originated this idea of having a commission in the legislation, and so they've always been in favor of a strong commission. They've seen their initial goals whittled down through the legislative process, but again, this is their chance to really come forward and support an idea that they've talked about as being very helpful for cost control over the long term, and so we have to see how they're going to weigh in in conference on that issue.
Good. So it sounds like I like the excise tax on high-end insurance plans in the Senate version, and you like the commission or advisory board in the Senate version of the bill. Is there anything about the House bill that you prefer over the Senate bill?
Yeah, I mean, the House bill does a lot of the insurance subsidy structures, and the National Health Exchange structure is much more effective and efficient in the House bill than it is in the Senate bill. And this isn't traditionally thought of as really a fiscal issue. But our concern is that if you have inadequate subsidies and kind of a haphazard exchange system created that the Senate leans towards more than the House, then ultimately you're going to have some major political demands to increase subsidies and change the way these exchanges are created. And if you do it right up front in the context of a bill that is paid for over 10 years and that really has a goal towards cost control, then you can have the proper trade-offs in the right context. If you wait until there's some crisis where you have a lot of middle-class Americans who can't afford health insurance, or you have rules added on these exchanged in kind of an ad hoc way, then you kind of have fiscal demands that could be met simply by doing giveaways to either people who can't afford insurance or to various industry groups that are interested in changing the way the exchanges are run, and you don't do it in a well thought out, fiscally responsible manner. So that is something the House does better.
Well, so there we have it. It'll be interesting to see what happens over the next few weeks and what we come out with in the end after conference. Thank you.
Thanks.